it's Lisa Bonsall, Senior Clinical Editor for Lippincott Nursing Center. I'm here at the Lippincott Nursing Education Innovation Summit, and right now I have the pleasure of speaking with Joy Goldsmith and Elaine Wittenberg, and we're going to talk about assessment and evaluation of communication concepts. Thank you so much for talking with me.
Thanks for having us.
Why is it important that the American Association of Colleges of Nursing identified communication as a core nursing value?
So we have come to understand through our own research that communication as a practice, as a theoretical concept, really has not been purposefully integrated into nurse education curricula across the country. By looking at descriptions of syllabi, by getting feedback from course coordinators and deans. There's really not a purposive, stepwise integration of communication into nurse education content. And so there are sort of two avenues of difficulty in that reality. One is that students are not getting rigorous social science-based content that is that offers some guidance and some answers to them and some tools for their practice. But the other part is nurse faculty do not have resources and a structured pathway to teach communication. So you end up with kind of an anecdotal approach to communication, or a kind of a surface engagement with communication. So nurses deserve and need specialized nurse-specific communication resource and content that's evidence-based and theory-driven. And so that's what this rollout of the new essentials will support, is that shift.
For a long time, communication's been known as a soft science. And this is a huge turning point in creating and establishing communication as a legitimate social science area of study and a legitimate area for training.
Thank you. What are 3 types of learning objectives for nurse communication?
Well, when we think about nurse communication, it really is about skill training, and skill training is essentially behavior change. And when you want somebody to change their behavior and do something differently than what they're normally doing or what they think is the best approach, there are several different factors that come into play with that. So that ties to the learning objectives in terms of providing communication, education, and instruction. So the first is that nursing students need the communication knowledge about communication and that social science approach, the theories, the frameworks, and the concepts. Once somebody has the knowledge of something new, then they have to have the right attitude. And so you have to teach different curriculum content that is going to impress upon the students the right communication attitudes and having a positive attitude and valuing communication skills. And once somebody has the knowledge and has a positive attitude, they're more willing to engage in behavior change, and that's where the skill comes in. And in the communication skills, it's about employing evidence-based practices that have shown to be effective with patients and families, and also are comfortable for nurses. So it's communication knowledge, communication attitude, and communication skill. All 3 of those are necessary.
How can those learning objectives link back to competency domains?
Well, the whole point of the AACN Essentials is to establish competency-based education, which essentially the goal of that is to show growth in the skill or to show growth in the competency. So similar to the learning objectives I just described, it would be a progressive building of communication skills that stems from knowledge, attitude into skill. So we identify entry-level skills as being building that knowledge base and understanding, and then building off of the knowledge base into positive attitudes and then the skills would come after that base has already been established. So you would need to provide competency assessment for knowledge, attitude, and then skill. And currently, there isn't a roadmap, if you will, for how to do this. So in most current programs, they're just trying to teach skill, and it's a big bucket list of 20 skills, and then students get nervous they're not going to remember all 20 skills, and then faculty are trying to assess for all 20, and we don't feel like that is a good approach. In fact, that's the strength of the AACN Essentials, by identifying communication as a concept, that then we're able to say, here's how you build into a skill.
So, for example, I think it's domain 9 that is population health, and there are lots of subdomains under that larger heading, but communication as a concept weaves readily across those subdomains. Like when you're thinking about things like cultural difference, when you're thinking about health literacy, when you're thinking about plain language, that's in our wheelhouse. And so we're interested in helping map those ideas, attitudes, and skills onto the domains and supporting nurse educators in that effort.
It's like patting your head and rubbing your belly at the same
and
time.
jumping up and down and chewing them.
Yeah, because we really don't know what we're doing, but we really do. I mean, and that's where the AACN Essentials is really great. It's giving us a framework, and so we can come to the table with 20 years of communication research
and evidence, and skills practice.
The mapping becomes easy. And so here today and at this conference, we're going to be providing a presentation that shows an example of how to accomplish that.
Thanks so much for talking to me today.
Thanks, Lisa.
Thank you.